Almost everyone knows what diabetes is, but not many people understand the impact it has on somebody's body. For those living with diabetes in remote and rural communities, there's still the problem of accessibility and inequity when it comes to basic care. My name is Elif Ekinci and I am the Director of Diabetes Care at Austin Health. I'm also a Professor at the University of Melbourne in Medicine and the Director at the Australian Centre for Accelerating Diabetes Innovations. Diabetes research and clinical care is my life. My grandmother got very sick when I was young, and watching people care for her is what inspired me to become a doctor. I studied medicine at the University of Melbourne, and I just found medicine so fascinating. There are so many systems of the body that are all interconnected. I was very curious. I think this was what drew me towards research in diabetes. It's a single disease that affects the body on many different levels. Because diabetes affects so many parts of the body, it means that we're seeing 1/3 of hospital admissions being diabetes related. It makes me very upset, particularly because sometimes I see that they're the sickest people in the hospital. Sometimes their outcomes are worse than cancer patients, and I don't think that's really being recognised.
It's the leading cause of blindness in the working age population, leading cause of kidney failure. There's over 100 amputations a week directly related to diabetes, and it increases your risk of heart attack and stroke.
What is absolutely critical is that we think about what happens when somebody can't get to a hospital in that emergency situation. I received a scholarship when I was studying medicine, which gave me the opportunity to work with people in remote Indigenous communities. I witnessed the inequities of our healthcare system firsthand. So many people in these communities don't have access to appropriate healthcare to manage their diabetes. And this is what really drives me to find a solution and to advocate for all the people who are dealing with this problem every day.
Leading early and mid-career diabetes researchers in Australia. Please join me in welcoming Professor Elif Ekinci.
Thank you. So I'm going to talk to you a little bit about my journey in all of this.
We launched the Australian Centre for Accelerating Diabetes Innovations in 2022. We're working on some exciting new research projects at Acadi and will deliver at least 18 new projects by 2026. We're working on a project which is improving the measurement of kidney function in diabetes by using machine learning. We're undertaking a clinical trial for flash glucose monitoring. We're using this skin patch device, and this measures and monitors a person's glucose levels. And it replaces the traditional painful finger prick testing. And what it does is help somebody avoid having high glucose levels or low glucose levels. We want the work we do at Acadi to help close the healthcare gap between urban and remote communities. I want my work to be meaningful and improve the lives of those with diabetes everywhere.
I guess it's an innovative ecosystem is a way of describing it. I was thinking at nights, how are we going to get all this education out there? But if you wanted to do a short course, it's through the University of Melbourne. You can check it out there. That's it.